Mr. Chairman, I'll be speaking on the amendment and on the underlying piece of legislation. This amendment makes technical and clarifying changes to the bill that incorporates technical assistance provided by the Department of Health and Human Services. Specifically, the amendment allows for more flexibility for HRSA to administer program with input from the poison centers. Additionally, the amendment clarifies the use of the Poison Control Center's nationwide public awareness campaign to include information on poisoning, toxic exposure, and drug misuse. Finally, the amendment reauthorizes the Poison Control Center network through fiscal year 2023 and sets the funding level equal to the current authorization. According to the CDC National Center for Injury Prevention and Control, poisoning is the leading cause of injury death in the United States. And poison control centers, of which we have 55 throughout the country, save countless lives. They prevent toxic exposure and poisoning injury, reducing billions of dollars in unnecessary health care costs while increasing public health awareness and access to tens of millions of Americans currently underserved by the present health care system. They also provide local, state, and federal governments and health agencies near real-time data and occurrence surveillance. Our bill will reauthorize funding for the Poison Control Center's toll-free phone number. And if you have ever called that number, especially as a parent, it is an incredible life-saving type of phone number. The national media campaign, which educates the public and healthcare providers, because healthcare providers also call this poison control number, about poison prevention, and it also provides for the state grant program through fiscal year 2023. Poison control centers receive about 15% of their funding through this program. So our bill clarifies that they can be called upon to assist in public health emergencies. It also ensures that FCC will work with HHS to ensure that calls to our 1-800 number are properly routed. Because right now they are routing to an individual's prefix rather than to their actual location. And so we need to ensure a more timely response, and we need to extend our nationwide public awareness campaign with HHS to promote the use of this number, particularly, and I think people don't often realize that overdoses are poisoning, and that's why so many people are calling. About 3 million calls are coming in annually, and their poison control centers are fielding about 192 cases a day of opioid misuse and abuse. With that, I yield back the balance of my time, and I also want to thank my colleagues for working with me, and I would yield